welcome to Plug. This is episode 1.
where this is two hearts, two journeys, one sleep story. We are raw, real, and unapologetically us.
I'm Nika,
And I am Selena.
and this is our episode 1.
What our episode one deals with today is what are the prerequisites for having weight loss surgery? Meaning, what are your requirements, basically? One of the requirements up front for our surgeon is along the way, we had to start with documented weight loss expectations for him.
Yes. Now, what she means by documented weight loss effort is that most doctors or surgeons want to see that you have at least tried to lose weight in the form either of diet, exercise, or medication. And those documented weight loss, you have to show that it failed, like you did a yo-yo effect where you lost the weight, but like most of us, it came back. So that's what our doctor required us to have. Now, for nationwide or in the United States, where most people are trying to do weight loss surgery, some of the prerequisites for that after you have the documented failed weight loss efforts is that you have to have a BMI of 40 or higher. And what that means is that you have to be clinically obese. Think about that.
Oh
Say
yeah,
you're at a BMI 38 and you have a history of heart failure or diabetes in your family, and you tried all of the exercising, the diet, and the medication, and nothing still works. But because you're just under that BMI, you have to continue your efforts either to lose the weight on your own, or some people will do that I've researched is to gain weight, and
yes,
that is truly, uh, I think a little bit of a sad or reality that some people you're just caught in that middle. Maybe you can find a doctor who can or is willing to assist you in other ways.
and that's how a lot of times um, patients. That's how a lot of time patients become um, introduced to the GLP-1s to try and give them that boost that they need to get them to a safe BMI to even be considered um, for weight loss surgery. Now, with that's just the tip of the iceberg as far as being uh, recommended or considered. I like to say considered for weight loss surgery. They have to know that you are a good candidate. That you're not just doing it for vain reasons, and that you are seriously considering your health. You're considering the mind change that happens with weight loss because it's
Yes,
not just losing the weight, it's in your mind as well. You have to make up your mind to say, this is what I want to do, and these are the steps that I'll be willing to take so it can be successful. So they need to know that your mental is there first.
absolutely.
And then, of course, after that, then they see that you're serious about it. You're doing what you need to do to either lose some of the weight, uh, the pre-mandated weight loss, some of it, or they see that you are serious mentally with losing the weight as well. What they'll do also, once they see that you are serious, then they would give you the guidelines, the other requirements that you need in order, the testing requirements, let's say, that you would need, because every surgeon is different. So um, once you they give you the guidelines of test requirements, then you know, okay, I'm on board. I'm headed in the right direction because it's not just weight. They have to medically clear you as well because you can't have heart issues. Let me just say, not just heart issues, but untreated heart issues. And you go through this process of trying to go under the knife and have weight loss surgery. You have to be cleared medically. They have to know that your heart is able to withstand um, the surgery. So that's how the cardiologists, pulmonary, all of those doctors come into play when it's as far as testing to make sure that you can be medical cleared for things.
Absolutely. Those are all good points. But also with our doctor, which is Dr. Sonny, over at the Eastside Bariatric Surgery Center, we had to undergo blood tests, EKG. We had to have a psychological evaluation to be cleared just to have surgery. Now, with having a BMI of 40 and be considered obese, there are some other requirements in case you don't meet the BMI at 40. You can either have a heart disease, which is scary enough in itself, and then you can have
Oh
high
yeah,
blood pressure,
yes,
and then severe sleep apnea.
absolutely.
To be honest with you guys, because we want to be transparent with you, I had three of those. I had a BMI of 42. I had severe sleep apnea, and I had high blood pressure. And being of African American descent, those are all considered life threatening. More and more of Black and African American people are diagnosed with high blood pressure and heart disease
Oh yeah,
than anything
definitely,
else. And
definitely.
if you will look it up, heart disease and type 2 diabetes is the leading cause of some deaths in African American communities. So, going into this, having this weight loss surgery, and then pursuing life under gastric, that's how we come up to show you that life is can be better if you take an active approach in your own weight loss journey, in your weight loss path. Because sometimes diet and exercise and medication doesn't work long term.
Right,
Now, we saying
right.
this is easy.
No, not at all.
Oh, we saying this is a shortcut to have the hourglass figure.
No, it's not done for vain purposes, or at least it should not be done for vain purposes.
Yeah, because having this done for vanity reasons is going to lead you back to gaining weight
Right.
because you don't have that mindset. Okay, I still have to watch what I eat. I still have to get up and go to the gym. I
Movement is so vital. And I don't mean to cut you off with that, but people real, they just say, "Oh, I could just change some of the things that I do as far as my
hmm
eating habit." But little do they know that it's very, very important that you move your body. And I cannot
absolutely.
emphasize that enough. That exercise, you know, I'm not saying that you have to go and join a gym right away or spend an hour, 2 hours, 3 hours in the gym. No,
Yes.
but at least getting your mind that you can start walking. That's cardio. That builds your stamina first because that's what you want to do. You want to build your stamina, get your legs moving, get your heart pumping, um, and give yourself a cap. Maybe you start off with 30 minutes. Um, do that maybe 2 weeks. Build yourself up maybe 10 more minutes until you build yourself up to an hour. And from an hour, then you can say, okay, I'll do this hour for 2 days a week. Then you've gotten your mobility, you've gotten your groove. You say, okay, I think I can do this 3 days a week. Maybe I can push it up to an hour and 15 minutes. But it's the thing is, you have to start somewhere with it.
A
Um,
beginning.
right. With the body movement, it is very imperative that you do it because gets your heart pumping, and not only that, it gets your metabolism going, and that's what you want to
Absolutely.
do.
Yes. Yes. That's a
So
good point there,
yeah,
Selena.
yeah, absolutely.
Because we both know that we were in a gym. Um, you were walking before we got married.
Yeah,
And at my highest weight, I was almost 350 pounds. Sometimes people get discouraged about going to the gym because of your weight. That's what the gym is for.
right.
And you don't act like Selena said, you don't have to go to the gym. You can take a walk for 30 minutes. That's a, if you look it up, if you get your body moving for 30 minutes, you can actually get that metabolism, your cardio, and your heart pumping to help you lose weight. We're not saying go in and be a bodybuilder, um, which some people have turned it into a life, putting muscle on. But you just want to begin to move your body and get your mind right. Is
Yeah,
sometimes people will tell you, okay, if you get out and you go exercise and cut your calories, everything will be all right. But what if you are cutting your calories, you are
right.
exercising,
That's true.
and the weight still is not coming off? One thing I don't like um, to hear some people say that because you're, excuse me, I'm going to use the F word here, fat, that you're
Right,
lazy.
right.
And that could be
Exactly.
further from the truth because you are working, you are watching what you're eating.
Everybody's metabolism is not the same,
Absolutely.
so
And it's,
that doesn't mean, oh, you're fat and lazy. Because you don't understand what my metabolism does to my body.
yeah,
It's
you
not the work doesn't work the same as yours.
that's true. And people fail to realize that everyone is different, but we're the same. We all trying to live a long, healthy life. We all trying to be healthy as possible. We all want to have the image that we see in the mirror pleasing to us. Now, I want you to understand when I say that pleasing to you, not to the outside world. If you're happy when you look into the mirror, you halfway there.
It's
If
true.
you're happy with the way that you look, don't let anybody else tell you to change. But if you're not happy with what you see in the mirror,
Results comes one small step at a time.
yes, and you have to realize that what we call non-scale victories, because that scale can be devastating.
Oh yeah, definitely.
It can be mind blowing.
Yeah,
You working, you exercising, you get
doesn't.
on that scale, you only lost a pound. But go try on a pair of pants that you couldn't wear a month ago, and I promise you that you'll be able to wear them. You're like, wait a minute, if I just lost a pound, why am I able to put these pants on that I wasn't able to either button or zip, but now I have room in them? Just think about that
Yeah,
for a minute.
yeah. And it's just there's a lot of people you want to see the pounds come off before the you know that it's actually inches. Inches is very important too, because that's how you grow into the pounds. But a lot of times, we as humans, we want to see the fast effect. We want to know, our work we applied that, oh, I'm going to see it right away in my pounds. But sorry to say, it don't work like that. It does start with inches, and inches are very valuable. It's very valuable with your weight loss journey, and it is valuable when you go to try on clothes that maybe didn't fit quite as well before. Then that's how you know, well, something is working. The scale isn't showing a difference in my weight as far as numbers, but your waistline is showing it in inches. And that's a great victory as well.
Absolutely. And that's why a lot of doctors require you to have a psychological evaluation
Yep,
because they don't want to do the surgery in vain if you're not able to mentally handle what
that's
comes
true.
along.
That's true.
Even with these prerequisites for weight loss surgery, you have to go in and battle yourself sometimes mentally to get ready. Um, People don't talk about body dysmorphia when you do lose the weight and you're still seeing that person you were a year or two ago. How do you handle it? That's the reason they have that psychological evaluation to make sure that you have the tools and the resources to actually go through this process. With our surgeon, after surgery, we signed, well, before surgery actually, we was a part of the support group.
Yeah,
If
sure.
no matter where
Sure
you
is.
are in the country, if you're going through a weight loss process, surgery, join a group, join a
Yeah.
good group. Let me say that.
And East Side, Piedmont East Side Hospital has a awesome um, support group, whether it's before, pre surgery, or post surgical weight loss. There is called Bariatric Eastside Bariatric Support Group. It is through the hospital in Snellville, Tree Lane in Snellville, Eastside Piedmont Eastside in Snellville. And if I can pull up this information, I'll get it for you. But anybody can attend because you can attend virtually. You can now, since COVID has subsided, you can also attend uh, in one of their facilities at the hospital, one of their boardrooms at the hospital. They have the actual room set up,
Hmm.
but you can go virtually as well. You can still it, and that's how we go. We
Yeah.
go through uh,
We
the
yeah, we go through virtually. While she's looking at information up for us to give you that, also keep in mind that when you go in these groups, you only get out what you put in. When you go to support groups, if you're just there to check off a check box on a for a list so that you can have weight loss surgery, it's not going to do you any good. We hear a lot of stories that people who have weight loss surgery and they say, "Well, it worked for me for about 2 years, but then I gained the weight back." It's a tool. It's not a quick fix. It
no,
is
it's not.
something to help you get to your weight loss goal. That's why they ask you to go see a nutritionist. We had a excellent nutritionist, and we still have one. We've been um, going through this surgery this year. It'd be 3 years,
Yeah, yeah,
and we
and we
have
still see our nutritionist. That is a vital part of it.
yes,
You can't just think you can have the surgery. Oh,
say,
I'm done. I can do it. No, you still need to have some
say
kind of
that
nutritionist.
part again.
You still need to have some type of nutritionist.
Because if you don't have a nutritionist to help you maintain, notice I say maintain your weight loss goal, you're gonna pick up some bad habits. Did you know? Because it only takes 21 days to form a good habit. You know how many days it takes to break a good habit and form bad? 7. Think about that. 21 days to form a good habit, but only 7 days to form bad. Um, so just think about that.
So it takes less uh, effort in the bad than it is uh, to establish the good. So
Absolutely, because you got to think about it. 21 days straight, you have to get up and motivate yourself. You have to train your mind. Okay, I'm gonna get up instead of having 3 pancakes, eggs, and sausage. Maybe I have 1 pancake and 2 strips of bacon. Do you see that? You're not taking away food that you like or you love, and that's when people fail to realize. Oh, you got to stop eating what you like. No, you just have to modify it.
yep.
And we went from cow's milk to almond milk. You don't realize how many calories or
It's just
what
yep.
in whole milk.
Right. Exactly.
So it's the little things that we take for granted that you can change. You found that information yet?
Yeah. It's just it's saying here support group insight. It's a support group follow up. It is. Let me just see here. did they have it? Let
Any
me.
information that we provide you guys through our podcast, if you go to our YouTube page, it's Plug and hit subscribe. Guess what? That subscribe button is free.
Absolutely.
And also on this podcast, if you like to become a partner, you can subscribe to our podcast and stay plugged in with us anytime we come on. This is our first episode. I want to give ourselves a hand clap because in the first step, we have to get out there. We have to make an effort, and this is something that we're going to get better at. We do appreciate you guys coming in and being plugged into us. And I have a question because I know a lot of people will. How did we come up with Plug? And I'm not going to say we. Let me take that back because I want to give her credit,
Oh,
but
well,
credit
thank
is
you.
due. My lovely wife, Selena, came up with the name Plug, and let our audience and our listeners know, how did you come up with Plug?
Well, we talked. We were driving somewhere, and we talked about establishing a podcast. And of course, we all know that name. We were driving somewhere one night, and we were talking about establishing a podcast. And we all know that in something great is thy name. So you have to get a name that signifies what you want to represent for whatever it is that you're doing in life. But I, of course, wanted it to be meaningful. So I'm thinking, and probably less than 5 minutes, it literally just dropped in my mind. And I was like, I got the name, I got it. And it'll be very imperative to what we're doing. And that is Plug. So she kind of looked at me like, plus, yeah, that's pursuing life under gastric because that's what we live our life for. Um, now that we're on a different path, um, everything that we do, we always keep in mind the weight loss goals, the uh, weight loss journey that we're on. We all often think of that. How does that intertwine that thing that we're doing? How does it intertwine into our everyday life as a bariatric uh, patient? You'll forever be a bariatric patient, whether it's pre or post. Um, so the name was very befitting because it correlates to our everyday life. We pursue life under gastric in everything that we do because it is life altering. So that's how I came up with the name, and it is acronym for Plug.
And I was shocked. I couldn't take credit for that because it is catchy. Plug. And we want you guys to plug into us on these
Absolutely.
episodes. This is, like we stated before, this is our first episode. This is our first time doing a podcast. We feel that it was necessary because we was out there trying to, when we were looking and researching for information about weight loss, it wasn't a lot of stuff out there for us. Um, so we were just decided, hey, why don't we put a podcast out there? We have a YouTube channel. It's called It's Plug. We would like for you guys to subscribe to that. Um,
Absolutely.
and also,
Subscription is free.
absolutely, just type
It's for the 0.00. Absolutely
for
free.
the free 99.
Absolutely.
So we would like to thank you guys for joining our first podcast. This is just
Thank you.
a quick or introduction of what we're speaking about, just about some prerequisites for weight loss, about some things that we had to do to go through our weight loss surgery. We do appreciate you guys tuning in. We hope that you like this information that we're putting out. You can also find us on Spotify. It's going to be It's Plug. just like our YouTube channel. And we do appreciate you guys tuning in with us today. And hopefully, we'll hear you and see you in our other podcast. We just want to thank you guys for getting plugged in. Once again, I'm Nika.
And I am Selena.
Thank you for plugging in to us today.
Thank you.